riddle me this. What will you do when you walk into an assignment? The last time you worked, it was a med surg floor. Now you come back and the section has a 10-bed specialized unit for trach and vented patients. And now you're assigned three stable trach and vented patients. As a new nurse coming off orientation, say you've only been on off orientation for about 2 to 3 months. How would you handle this? And by the way, you only had 1 hour of training on how to take care of trach and vented patients. How would you handle that? Would you go to the charge nurse? Would you go to your unit manager? Would you go to the nursing supervisor? How would you handle what is now really a critical care patient? Would you ask for the policy and procedures? In the least, that may be the only thing that protects you is finding out where the policies and procedures are, because that is where the Board of Nursing will look at any kind of discrepancies that happen with your scope of practice and also the policies and procedures. If you are going through this, know that you're not the only one, but understand that you will have to learn how to navigate this and learn how to navigate it in a way that you are standing up for yourself, number one, but also really being aware that sometimes you may face retaliation. But at the end of the day, you'll still have your license. Learn how to document. Make sure you find advocates on your floor who will be mentors for you and guide you along this process. But know that if it is not within your scope of practice, if there's not any kind of policies and procedures that dictate and that show you and explain to you what it is emphatically that needs to be done in black and white, you do not have to accept that assignment. But understand that when you accept that assignment, you also now accept responsibility. And this is a quagmire that a lot of new nurses don't realize, that you do have the right, if it's not within your scope, right? If you have not taken care of this patient, if you have not been trained appropriately to take care of these kinds of patients, you are able to not accept the assignment and it will not be used against you. Number one, because you haven't been taught how to take care of this kind of patient, okay? But the moment you accept it, you now accept responsibility. Guys, it's an ocean out there. If you're a new nurse, it's an ocean. I'm not trying to scare you, but you need to find people, you need to find advocates who will help you and help you navigate, especially your first year in nursing. So go ahead, find a mentor on the floor. If there's no one on the floor that you feel like you can trust, you're more than welcome to check out my resources that I have in my stand store. I have a documentation guide. I also have one-on-one coaching and I also have group coaching. But make sure you find the resources that will ensure that you have the best first year as a nurse. Like and follow for more.